Good afternoon, everyone. Today is August 25th. Welcome to NuPath's weekly town hall, virtual town hall. This is the day each week that we dedicate to looking at the data, looking at policy, looking at procedures, things that are affecting our community, our families, hopefully a chance to answer questions that may arise and to keep everybody apprised of what's going on, not just within the organization, but thinking about how we are responding in relationship to the guidance that we continue to receive from Massachusetts and in relation to what is happening on a national stage and globally regarding the COVID-19 pandemic. So as we do often in these broadcasts, we begin by looking at the data, the number of cases in Massachusetts and the number of deaths and so on in Massachusetts and the world. So beginning with Massachusetts, we now have 126,000 confirmed cases of COVID-19 with 8,949 deaths. That represents an increase of 107 deaths from the previous week, and the week before that it had increased by 101. So we're kind of holding steady there. In the United States, we are now at 5.75 million cases confirmed with 177,000 deaths, which represents an increase of 7,000 deaths from the previous week, and the previous week before that was 7,000. So on a national level, we seem to be holding steady. Globally, we are now at 23.7 million confirmed cases. These numbers are so huge, I can't even fathom. With 814,000 people dead because of COVID-19, this representing a 41,000 increase from the previous week. The week before that, it had been 39,000. I often seek to find different ways for us to consider what's happening in our world and things that have struck me as I've gone through the previous week. And when we think about what this means, if you consider that the US population at 300 some odd million people represents about 4% of the total global people on Earth, we represent 24% of the cases of COVID-19 when you think about it globally. And when it comes to the number of deaths related to COVID-19, the United States accounts for 22%. That's an important disparity and one that I think is significant to keep in mind. In fact, if you look at the list of countries and the number of cases of COVID-19 and the deaths, the United States at 4% of the world's population leads both in the number of cases and in the number of deaths when compared with every other country on this earth. So if you're outside looking in right now, the United States does not seem like a very safe place to be. But we are focused on Massachusetts, and so much of what we do and are determining to do is based upon this slide that you see before you. This is from the mass.gov site, and this in particular section of it is what we talk about being the dashboard of indicators. And what's significant here is you see we've gone from 3 green and 3 yellow to 4 now green and 2 yellow, which is a good thing. I was wondering when that was going to happen, and this week it did. And the green light now is in the contact tracing capability. So this is in the Massachusetts network and the framework that has evolved to do the contact tracing. This is when somebody is found to be positive. The Department of Public Health will, review who they've come in contact with. If you walk into any of our day programs, you are asked to sign your name, we take your temperature, and so on. This is also to aid with the contact tracing, and we are now at a number where we are determined to be in a positive trend related to contact tracing. The yellows representing in progress. So one of the things we look at is the positivity test, or the percent positive tests that are experienced, and we at Massachusetts are now at 1.4%. This is significant that we're low, because if you look back beginning in July 19th, when we began to see an alarming reversal of what had been a very positive trend, there were a number of weeks where or days that we were reporting above 2%, and we really want to get this down to around 1% or below. Epidemiologists say that if that you're in a population where that is your positivity rate, then the chances of anyone getting it are really decreased significantly. That means when you walk outside your door, you are just coming across fewer and fewer cases of people that have it. And I think when we were talking with Matt last week, we acknowledged that there may be cases where there may be incidents where some of us go through our entire days, whether we're in the grocery store or other places, where we may not encounter anyone who has COVID-19. But this is only because we have been able to suppress this, and doing so by following all of the guidance related to the wearing of masks, the washing of hands, and so forth. As you recall, last week at our town hall, we talked about this guidance that had come out from Massachusetts Department of Developmental Services related to the testing, mandatory testing. And then just a couple of days later, we received through our own human resources further guidance for all the staff. Now, last Tuesday, when I was talking to Matt, I promised that by this day we would be able to talk much more specifically of what this meant to our staff and how this was going to be implemented. Now, mind you, we are in I won't say competition, but we're in the marketplace with many other providers across the state that are in similar situations of having to get all of their congregate care workers tested. And so even though Massachusetts is doing very well in the testing capacity and the number of tests they're able to administer in a given day, it still is required some doing. I want to just give my just a note of praise to the team that helped to develop the NuPath approach to how we are going to assist all of our staff to get tested. And right now, this is related to those people working in our congregate care units or specifically our residential programs. But I'm going to ask Greg to bring Dan Lannon on in a minute. And Dan's going to join us to talk about how we're, and as he said to me just before we went live today, that we're casting a very broad net when it comes to the staff that are going to be required to get the test and to demonstrate a negative result as of August 1st and going forward. So this will be related to facilities, clinical, anybody that really has a need to interact or engage with anybody from our residential teams. Dan, welcome, and thank you for being here today to maybe answer some questions and to provide a little further detail and clarity around what we're going to be undertaking. In the my 30 years experience or more, or more than 30 years working in this field in Massachusetts, I've never before been in a situation that's quite like this. We require our staff to, upon employment, to provide proof of citizenship. We expect them to provide a recent Corey check, which is the criminal represents the criminal any possible criminal behavior from the past, and we ask for driving records and a number of things, but we've never tried to or had to have people tested for something like this en masse. So this is just adding another layer of responsibility for our staff that are expected to go and get the test, to provide proof of testing, but also for our human resources to sort of manage this and monitor this. And then for your staff who are scheduling and trying to ensure that the people that are being assigned to shifts have met this new guidance. Can you talk to us about what it's been like for you guys, or how you're finding it? Is it just business as usual, or has this been something that's required, some superhuman kind of planning?
No, I think, yeah, I think it certainly involved a lot of planning, and there was I would say a larger group than usual that had worked on this with us to make sure we hit all possibilities and aspects of anyone who would have a chance to be, interaction with our residential homes. And so certainly, certainly the guideline is, when it first came out, was for all residential staff. And even when we received that guidance, we treated it sort of like you mentioned, with the wider net. Meaning, if our facilities team was going to go into the residential component, we expected them to take part in this, or our nursing team going into the residential components, then they would be part of that net for us. And so, certainly, that as you said, we're in the marketplace, we're in competition with other agencies, I guess, to have, to meet the timeline to have everyone tested. We certainly experienced this last Friday when a number of people went in to get tested at one of the pop-up locations that we had shared with staff, and the wait times for people as they went to get tested were just outrageous, and the organization of it just seemed a little too chaotic for us. So luckily, there was a group prior to that securing some other more convenient ways for staff and for people to get tested. And so we were able to find 3 locations that we were able to make arrangements with and have contracts with, so that staff can go in, get tested at their leisure. They'll be provided the paperwork then to hand into HR, and HR will help compose that information so that we can assure that no one slips through the crack. But it certainly is much greater than just residential that we're including in this, because I think, as we talked about, and as I just heard you say, I think this is just phase 1 of what we know ultimately will be the larger expectation, which is everybody here within NuPath will need to be tested. And so this is just the day service, the residential component right now, but certainly it's gonna move into the day component next. And so the more people we can capture right away, the better. And for those 3 locations, if you're not sure where those 3 locations are, or the agencies, I'll read them off now, but then certainly reach out to your supervisor or to HR and they can help you. It is Carewell, Convenient MD, and Arc Point. And at each of those locations, some of them are just drop in, some of them you have to call and schedule an appointment, but at none of those locations will you be expected to make payment. The NuPath will be picking up that cost, and we are going to manage that behind the scenes. So that was huge, because there were a number of places that were willing to do it, just not willing to make those arrangements with us. And so so I think the team did a great job with that. I think we learned our lesson with the pop-up testing, for which involved in a few calls earlier today. I know you were on one of them, and in the meeting I had yesterday, where a lot of people are relying solely on the pop-up testing, and I just think those lines in waiting for staff are going to be very discouraging. So,
Dan, we've got a couple questions. I also heard on one of the calls today that it will be the responsibility. Well, let me see if I can get this right. It'll be the responsibility of the staff person to have some proof of their negative test. So that if we're putting people on the shift, is that right? Are we going to rely on these 3 sites to communicate that to us? I think the question that came up may have been in Kelly Lawless's call. It was whether or not the relief staff that we may be scheduling on shift, that we've got the responsibility to attest to the fact that they've had a negative test, or that we've confirmed that they're not positive anyway. How is that going to work? Is that something that staff will get on site, or they'll have to wait until it's emailed to them, or do you know how that's going to work?
So if you're someone that's on that relief list and you work within the residential component, you've already been reached out to go ahead and take your test. And so once they take their test, they'll submit that to HR. And then the people scheduling for those relief shifts, the managers and directors primarily, will have a list of all the people who have complied with the COVID testing. So therefore, they'll know that if Dan Harrison hadn't had his COVID test, then I can't use him for that shift that I have coming up Thursday. I think what happened today was, I guess the only way I would describe it is people really going above and beyond, going down a rabbit hole of what ifs that I don't think that I don't think, ultimately will come up to in fruition to be a procedure that anyone has. I think as long as it's managed at the HR level and the people scheduling the shifts have a list of those people that we have the testing for, I think we can manage it there. I think that so many people were concerned with the idea of having a lanyard or something to identify that you have been tested, was not something that people would feel comfortable with long term. And so I think the idea that we're not scheduling anyone unless we can assure or attest that they've had the test is something that we can do. And
On
then
the other
all,
hand, if I could just
yeah,
say something about that. The other hand, I mean, of course, a lanyard, I think that would be, let's say ridiculous, but I know it was something that we heard on the call, but at the same time, it's important for staff to know that if they're getting their tests through NuPath and for NuPath, for those staff that maybe are working at other organizations or that have employment elsewhere, this is something that they will probably want a record for, because it's not just they may be asked to provide it at some future point, right? I mean, we don't.
well, that's an excellent point. And that's why I felt like the relationships and where we're asking staff to go to these 3 locations where we'll have some written documentation for staff that they were tested and that they tested negative, so that if they do work at another agency, all they would have to do is ask us for that documentation that they'll also receive it in their email, but they would be able to get that documentation and say, I have been tested, I work at NuPath, and I have gone. The tough part about the identification sort of tags or lanyards or all that, there is some additional, and this is we've learned our lesson now. There are additional guidances continuously being tweaked and being added on, right? So at first it was, this is your baseline testing. Everyone's going to need to be baseline tested. We got some more written clarification coming out. And then all of a sudden, if a residential home or if a work location goes into a red area of high cases, those people, those staff at those houses will have to be tested again. And so there are now some additional compliance. And so you could, in theory, walk around with, I have been tested, I'm fine, I'm clear. But, if you're not aware, or if that agency hasn't kept track of when your area goes into a red thing, your test could have been prior to that.
Mm-hmm. So I think we're talking about a couple of different things.
I'm confusing myself during that explanation.
But I think that what I was saying in the first part of my conversation is, yes, I suppose they could have say, oh, I got tested through NuPath, call NuPath. I don't think Karen Franklin wants to be ferreting all these different calls trying to produce documentation for staff that are working for other organizations. In other words, it would be the staff responsibility to try to, for this first, initial baseline. If you get tested and you get something in the mail, you may want to just keep that handy if you're working for other organizations, rather than, us, people calling us, contacting us from other human resources and other agencies saying, do you have the certificate? That was the first part. But then I think you start talking about what happens, what would, the baseline, we talked about it a little bit last week and Matt explained it to us, but right now we're getting baseline. We're getting tested for everybody that was working residentially. And the idea is that going forward, if there would happen to be a cluster of positive tests, let's say 3 or 4 individuals in a particular home were tested positive, or staff, or if within a particular area, whether that be a city, town, or part of a county, if the Department of Public Health recognized what they consider to be a spike, an increase in the number of cases, that they would then legislate or mandate that there would be this, surveillance testing, which could be, testing every week or some frequency to, at a heightened level of intensity than other places we're experiencing, because you're in a, as you say, a red zone. So, and that would be then that would be a whole other story. We're not there yet because we're not in a red zone, right, Dan?
Correct. Essex County, it is not currently.
Essex and Middlesex.
Essex and
yeah. So, but if that should happen, then that would change things a bit. And yeah, go ahead.
Yeah, so I guess that's what I was trying to explain is why it might, what might give families and some people a peace of mind to know that they can show up for their visit and see that the staff have identification that they've been tested, but they wouldn't necessarily know what the most recent restrictions are or guidelines are for that particular area. And that's really the planning and the organization behind the scenes that is going to come from this, right? You know, everything's sort of in phases, and this is the first phase of it to get that baseline. But that's really where we're really going to have to be at the top of our game going forward to just make sure that, you know, that we're meeting and we're complying with all the regs and the expectations that are being asked of us, and that we're keeping.
Yeah, sorry, go ahead.
That we're just keeping people as safe as possible.
I was just going to kind of comment that, you know, when you're talking about the reverse of, like, you know, the scarlet letter, where, you know, you wear some sort of insignia where people would say, okay, that person's, you know, safe, they've been tested. We're not going to be doing anything like that. There's not going to be any sort of physical, or maybe a decal you could put on your car, you know, this car is no COVID on board or something. We're not going to be at those levels. This is really, this is like a blend of organizational and personal responsibility, where our staff are going to be working in concert with our human resources and their managers to make sure that we're fully complying in every area, in every way, because we wish to be good citizens, when we wish to you know, proceed in a way and in a manner that is supporting the good of the collective. And for us in Massachusetts, that means every citizen, and I suppose we'll add New Hampshire in there too, since we have a lot of staff that live in New Hampshire and commute to Massachusetts. But none of us are safe if we can't go outside into the public space and worry that we're going to, you know, encounter lots of, you know, COVID virus, you know, kind of floating around. I've personally been tested twice so far. Dan, have you been tested yet at all?
I am embarrassed to say I have not been.
Don't be embarrassed, but you just haven't had a reason. But when we talk about casting a wider net, so it's my plan to get tested. I'm not, you know, necessarily going to be in contact, you know, with, you know, a great intensity with residential people, but, you know, part of this idea that this is something we're all going to be expected to do at some point, and at least for now, what they're telling us is that if you've had a test, you know, from August 1st on, now that may change for, you know, the next wave. Maybe they'll say it has to be as of September, you know, depending on how they determine things. But I think it makes sense to, you know, get it. Are you going to plan on?
Yeah, I'll be part of this first initial group and phase that
Mm-hmm.
tested, and I know, you know, I know a number of people went on Friday that would be positions that you don't necessarily relate directly to our residential network that have already gone and been tested, and the results come back, you know, pretty quickly. From
Quickly, what does that mean? How
I think when you were tested Friday, it was back Sunday.
I was back
So,
on Sunday.
yeah, and you know, just to clarify again, and because I think it speaks to the relief people that are working within our agency, is that when you go and get tested at one of these locations for through NuPath, you know, you will get the email of the results, as well as NuPath will get that email, and so that's then their proof to go to another agency. And so they should get that at another agency, but if they don't, they will definitely get it through us.
Mm-hmm.
You know, and so I think that, you know, that's the best way we can do it. And you know, there would, you heard on the call today that some people have a feeling like this is you know, wasting some vital resources by doing so much testing and everything, but I think that's a small minority that feel that way. I think that if we can provide some peace of mind, you know what I mean, and assure and really add some assurance that people are healthy and safe, and that we have a good baseline of people, you know, not currently carrying the virus, I think that's important.
Mm-hmm, mm-hmm. Dan, have we had any more cases? I usually try to ask that before we go live, just so I'm not surprised. But do you know of any?
No, we're in a good you know, good spot right now.
And today during the I think it was ADP call, when or maybe it was it ADP, when Ellen asked whether or not organizations had been, you know, experiencing an increase, that she was met with generally a sense of no. I mean, things seem to feel, I mean, this is anecdotal because I don't have the data right in front of me, but We've not heard of there being a huge spike anywhere that you're aware of, or
No, no, you're right. And, and Kelly reported that as well. I don't know if it was on this call that she said that, but she did reference that before that, I think July 19th happened, as you mentioned, and there was a spike that happened and people almost began, you know, maybe some people identified the spikes or the one or two cases that they had at their agency as spikes. And I think that caused concern and alarm to some people. And luckily those weren't true spikes. Those were just one or two cases. And so it's been pretty calm, knock on wood, in the area. And there is no current spike within DDS and our field right now, which is
so
great news.
this is important because as we have now, we're well into our third week of reopening our day programs, or is it our fourth week? And what is it? Third?
Third week. Yep.
Yeah.
Third week. Yeah.
I was on my way out yesterday, and Michael Edwards happened to be downstairs, and I said, how's everything going with the reopening? And he says, oh, we've got a few more people coming in, and I think I shouldn't do this because I don't have the facts in front of me, but we've increased slowly the numbers of people that we have here. Do you know, like, roughly how many people we have at our home office here, our home office location?
So the low 20s, We certainly we have about 17, full-time, 5-day a week people showing up, and then we have ASD homes coming in for a short period of the day. So that's why during that time that number spikes a little bit, but
so we're not alone, as far as, within the landscape of different organizations that have opened partially or trying to reopen. And so we monitor this data so carefully because we want to know, is this, will this relate in this sort of some of the more technically not lagging indicators. The lagging indicator would be death if somebody got sick and then eventually died. But since this virus is the type of thing that you can have a major problem and not really be aware of it until several weeks later. So just the way symptoms manifest and that people are identifying this, but we're feeling pretty good, don't we think, generally, that so far with what we've done, we've been fortunate to not see any kind of a spike or an increase, and that means that we should be continuing, because as we've said time and time again, we as Labor Day's around the corner, as everybody's trying to figure out what to do about kids in school, and as we continue to think about our day services, we need to be figuring out how to live with this virus sort of hovering above us into the indefinite future, because we don't know when a vaccine is going to be available, and we wish to return to some normal rhythm of life, don't we? And the way we're going to do this is by monitoring the data and being very well, and making sure that we're safe and clean and everything is done in accordance to the most current guidance. But we're feeling good about the fact that we haven't had any cases.
I mean, yeah, so I think we're feeling great actually about what we have set up for day services for people returning, and systems that we have in place, and checks and balances. And if you remember, I said it here in one of the town halls when we announced what our plans were to start returning, is we're not, we didn't build our return based on solely the number of people that we expected or anticipated having in day one. We sort of built it on what was going to be the long-term approach that we would need to take to be able to have people can grow and have that number grow consistently. And so, although that number is at 17 right now, and I actually, a parent referenced it about the staff, the number of staff we have, because we have different roles for people doing it. The people that are checking the temperature when you first arrive, and ensuring that everyone is healthy, has a different role than the next staff that is working in the day programs. And so I think those different roles are what's going to give people peace of mind to grow and feel more comfortable coming back, because then the next layer would be transportation being added in. So now we have a lot of family members driving people in. Well, those are going to shift to outside transportation companies soon enough, and we'll be able to really make sure that the protocols and the systems that we have set up can handle that in a volume for that, so that then we can continue to try to attract more. The residential components those individuals that don't live within our unit, our residential units, but attend from other residential agencies. That is still a huge variable where there is a lot of discussion on what's you know, will this agency let their individuals return? Will they not let them return? You know, what's going to be the process for that? And I think everything is going to get worked out. And I think it has to be, you know, this phased approach, because I do think that, you know, we're hearing transportation. We heard originally the transportation was available, just submit, you know, the process that we would have to do to get someone approved. And then we're also now hearing that it's probably looking like maybe the second week in September that the regional transportation company will be ready to start allowing transportation to happen for some of the individuals. And so I think everything is in phases and steps, and we're just taking it slow. I don't you know, you and I have talked about this. I think that sometimes people are speaking about things that are concerning to them, or questions that aren't answered that are down the line. And I think what we learned throughout this whole process is that if you're worrying about down the line, it's going to change by the time you get there. So let's just address what, you know, what's in front of us and what we can handle and control right now, and then we move to that next phase. Certainly, there's other planning down the line that we need to do, and that is happening. But I think for as far as making sure that a family member or a loved one is comfortable returning, that's our first focus right now.
I heard more talk about transportation today of the calls that I had in any of the previous calls, and was kind of just not really surprised, but just according to some reports, it sounds like many organizations are running their own transportation routes and trying to manage the transport. I mean, I think that that is so critical for us, is thinking about, you know, expanding the number of people that we're able to serve, as far as you know, providing, you know, that option for folks to get in. And I think that, you know, would you say let's not worry about what's down the road? Of course, that's also you know, it'd be a relief not to worry about that, but at the same time, it's kind of the biggest part of the puzzle, that if we think that we can legit get, you know, 50% or more of our people back, 40% or more, you know, that changes the algebra, doesn't it, for next year, as far as our budget goes, as far as how we manage our expenses to be in accordance with what we're making for revenue, and all of the business side of things that we have to take into consideration if we're going to remain, you know, a viable organization. So I think that that's the part that makes all of this so slippery, is that we just don't know what this virus is going to do, where we're going to be in 1 month, never mind 6 months. And as we try to plan for, you know, our fiscal year for NuPath begins January 1st. And so in September would be, you know, more or less the time that we'd be asking our board to approve our budget for next year, and begin to plan for, you know, and not knowing, you know, it really puts us at a disadvantage as to how we you know, manage our you know, all of the things that are part of our expense, you know, column, and what do we need to do to reduce the expenses to be in accordance with what we're able to bill for. So
certainly, you know, I agree with you on that, and I know we've had, you know, several conversations on that, and the best plan of action and best strategizing and predicting of what we can try to do. I think where what we heard today, and what we've sort of had be our procedure, is that these agencies like us that might be rushing into doing transportation, if you didn't normally come in NuPath Transportation, then Mott is still going to go through their process of putting your name out to bid. So although NuPath then could have done your transportation for a week of two, it's your son or daughter would then go out to bid to somebody else, and in 2 weeks that transportation could be changing again for that person. And that actually slows down the process, because at that both times you need to do, in some cases, a new PT1. And this is all just boring stuff behind the scenes, but my feeling is that it's going to slow down some people getting on transportation the way some agencies address that. You see what I mean? Because if I'm submitting Dan Harris's name and saying you need transportation, but the agency is taking care of it right now, but they just want to get you on Mart transportation when it's available, you're going to move to the bottom of the list, at least in my opinion, and at least from some people that I have shared this opinion with. Whereas opposed to if NuPath didn't pick up your transportation, you're coming up as almost red flag saying you don't have transportation currently right now. You know what I mean? We need to get a ride in for this person. So then therefore Mart is actively looking for a transportation for that person. And we treated the people whose families couldn't provide them transportation in, as well as the families that drove their loved ones in to just get through the first couple of weeks the same, which is they still require transportation. And then those are the people that we think the 1st of September we're going to be able to get on transportation for. And we'll have to see how the other plays out for those people that rushed in to do those routes, because it's been assured a few times, right? There is no money. Mart has no additional money, and so if Mart's putting, somebody out for a bid, and that's the route that makes the most sense because there might be a group home right down the street where they want to have those 2 people drive on that same van, NuPath would lose that transportation for that person, and then we'd be sort of doing transportation for one person, having a hard time adding anyone to that because that's the transportation we signed up for, where we're better off waiting for the transportation request to come from Mart to say, these are the people, who can you put together, who lives close.
I think that your explanation just now shows what an expert you are and how complex the situation is, because I think there's gonna be a lot of people confused by what you just said.
So I just bored you. That's okay.
I don't think it was your intention. But if I'm a family member out there that's just listened to that I guess you'd say recommendation in some way, because it felt like it was a veiled recommendation. What are you really saying? Just be patient, and if you want somebody to continue on NuPath transportation, that's going to be the next phase for us to get that up and running. But if you rush into something, you may have your child may go to some different route that might get them here sooner, but maybe it won't be better.
Right. Well, I don't even think you'd get that. I think what you'd get if you're on NuPath's transportation and you want to come back to the program, we've helped some of those people have that happen. We haven't got reimbursed for it yet, but we've helped a group of those people have that happen. DDS has just approved us to submit the names of the people that we do DDS transport for to come back and to do transportation for us. So we'll be able to start setting that up soon, for the 1st of September. It's going to be those people that come to NuPath that aren't on NuPath's transportation, but say through a Gentle Arms or another vendor, that those people right now, if we rush to take them on and then, to get them here, and then all of a sudden their name would then go out and not be prioritized for transportation through the same way, where Gentle Arms might be able to just pick up that route seamlessly and start again, and might be changing that route. And so then therefore you don't have the assurance that you're going to be able to continue that transportation once, you know what I mean, once Mart starts putting out what the routes are. So the crux of the whole thing was that if you were a family member and you could provide transportation in, that was the best thing. If you were someone that, your son or daughter lived at home and you couldn't provide transportation in, then we wanted to make sure we didn't do anything that slowed down your name being approved to get transportation in for the 1st of September. And so that's why instead of us just saying we'll do it, we felt like no, because then all of a sudden that's going to give, that at least from what we were hearing, they're prioritizing people that don't have a ride at all. And so then therefore we wanted to treat everybody like they didn't have a ride.
Okay. Well, I think that, as more becomes evident, we'll dedicate maybe one of these town halls talking a little bit more specifically about transportation as it relates to.
I've had a couple of Tuesdays off in a row. I'll take that Tuesday off if I can. That sounds great.
Oh, so because you had a couple of Tuesdays off, you want another one off?
That's what we're going to talk about. It's
okay. So it's definitely it's a necessary evil in this whole thing, and I don't mean evil in the sense it's not really evil, but it's a challenge that just is one more thing that has to be figured out. But we're taking it day by day as more information becomes available. as we push up against the end here, let's see, check in with Greg and see, Greg, are there any questions that Dan or I could answer? Probably Dan more likely could answer if it's something specific about what's happening.
Sure. A question just came in from a parent. It said, regarding MART, who is creating the health protocols for sitting on the bus when it does begin, such as number of clients on vans, masks, protocols, etc.? My son uses a wheelchair, and I would be extremely hesitant to use transportation without understanding their protocols. Thank you.
Good question. That's good.
Yeah, that's a great question. Yes, so there are the guidelines that we have to attest to through the MOT contract, and those guidelines were outlined by MOT, which is the 6 feet of social distancing, the mask. MOT currently is not requiring transportation companies to take temperatures before getting on the van. So we are taking temperatures before people come into the building, but I will tell you that NuPath Transportation, I believe we are going to do temperatures before people get on the van, because it just seems to make sense that if you have that ability to do that, why not do that and save some greater exposure for somebody else. And so those protocols do exist through MOT, and certainly, if you want to reach out to your program manager or director, we can send those along to you to try to have you, have some more comfort level and assurance of that. But I can tell you, as it stands right now, a minivan is not allowed to have any more than 2 people on it. A 15-passenger van is not allowed to have any more than 3 people on it,
including the driver, right? In these cases.
The 15-passenger van is not including the driver.
Okay. What about the minivan? I thought the minivan was only 1, but
I'd have to go back and check. I think that's what got confusion today during the call, where MOT made one regulation and HST made another regulation. Or no, HST made their guidelines and regulations, and MOT, when they went to distribute them, tweaked them a little bit. And so people didn't know which one they were supposed to follow.
maybe that's something we could provide a link to on our website, Greg. I don't know if that's something we could do in case, just where the most current, sort of guidance is that your families wanted to see, to make that easier for them, because as you say, Dan, it's changing with regularity.
My understanding about wheelchair, those individuals being transported in a wheelchair, I believe all those were going to be single and direct. Don't quote me on that. I believe that was going to be single and direct, though.
So in answer to this parent's question, your child should be the only one on that van at this point in time.
I believe so.
There's only one wheelchair in a van. And so what we're really looking at is doing multi-routes, runs, multiple runs during, in the morning and in the afternoon. So what you may see is some organizations or some programs doing some staggered start times. Maybe your child gets, begins their day program from 8 to 2. Somebody else could be 9 to 3, and all of that based upon the ability of these standards or this guidance to be met. So.
Yeah, and it's funny that you mentioned that, because we did today earlier in a meeting we had in a group we talked about that the arrival times and the departure times for the individuals being transported in, that we're going to expand, and just to try to be a little more flexible to those outside transportation companies coming in, so that somebody, someone could arrive as early as 8:30 instead of the 9 o'clock time frame, and then this, on the flip side, be picked up as early as 2:30 or as needed, so to be able to allow that transportation company to offer some more transportation.
Okay. Anything else, Greg? Any other questions?
No, that's it, guys. Thank you.
Awesome.
All right. Well, Dan, thank you so much for joining us. And as we race to the end of this summer, it's hard to believe, but going into the to the fall and winter, we aspire to continue to maintain the guidance to the best of our ability and to report honestly, the data that we have. Obviously, we're working in conjunction with many forces and entities greater than us, but we're nonetheless, accountable to many different sources, and will continue to be to our families and our staff and our clients most of all. So, thanks for your information, for being here.
All right. Thank you.
Thanks, Dan. All right. that concludes another one of our town halls, and I want to thank you all very much for joining us. On Thursday, you'll want to tune in to our weekly Unity Forum. This week, I think the focus is we're going to be talking to some of our clients that have either re-entered the workforce or attempted to re-enter the workforce, or just to check in with them and see how their experiences are evolving during this time of uncertainty and constant flux and change. So again, this is our business, and we've got to figure out a way to do it, even as this virus and this pandemic continues to menace and to hover over us. We could do this together. I know we can, because we're smart, and because we're united, and because we are NuPath. So we got this, guys, and I look forward to seeing you all on Thursday. Thanks, everyone. Take care. Bye-bye.